Advisory Committee on Immunization Practices, which recommends to the CDC as to what vaccines should be given and when, has decided to not make a change in the hepatitis B vaccine series. Hepatitis B vaccine is typically given to newborns before they leave the hospital, and then there are a couple more doses done over the next 4 months. Now, the recommendation has always been you start it, and the reason why is to protect the baby from catching hepatitis B from the mother. If the vaccine is given along with an immunoglobulin against hepatitis B, there is really great protection. However, it is routinely checked for the hepatitis B level for the mother during the pregnancy. Now, this committee did recommend, again, that all mothers be universally tested, but that hasn't changed. That's what the Academy of Pediatrics, the American College of OBGYNs has always been saying. So that really hasn't changed. But the pushback about and the call for making a change has been based upon the fact that the way that hepatitis B is typically contracted, which is through sexual contact or IV drug use shared needles, is not really something that newborn babies are participating in. Now, there have been rare cases where a mother did pass it along, maybe the test was false. And of course, if there is no prenatal care and there was no testing, then of course that's risky to the baby because A, the test wasn't done, but it also means that the mom really wasn't up on her health care in the first place and may be more at risk of having hepatitis B in the first place. And in those situations, it certainly does make sense to be giving those types of treatments right off the bat. But the question is it really warranted to do it if you know the mother's status? That's the pushback. So now you have an understanding of what it is, but the recommendation, as I said, is to not make any changes. There was no new data presented, and they felt that they needed more data if they were to make a change. So now you know about this one, and I hope you have a great day.